Now we can see what are different types of cerebral edema. Here we are having you all have to strictly keeping in mind we are having three kinds of cerebral edema, three types of cerebral edema. I will read first one vasogenic cerebral edema, second one cytotoxic cerebral edema, third one interstitial cerebral edema. Okay, so here we can see one by one. Vasogenic cerebral edema. First one is vasogenic cerebral edema. From the name itself, you should be able to identify what will be the basic cause and what is the main characteristic that happen with this particular cerebral edema. Okay, so vasogenic. Vasogenic means something related to blood vessels. So here the origin, the basic characteristics will be related to the blood vessels. So let's read the most common type of cerebral edema. So this one is the most common, mainly in the white matter, and it is characterized by leakage of macromolecules from the capillaries into the surrounding extracellular spaces. So three things we have to keep in mind. Okay, the first one, this one is a most common type of cerebral edema. So that is the first thing. Then second thing, this is happening in the white matter in the brain. It is mainly occur in the white matter, and the basic reason for this occurrence of vasogenic cerebral edema is the leakage of macromolecules from the capillaries, from the blood circulatory system itself. Leakage of macromolecules from the capillaries into the extracellular space. This is the reason for vasogenic cerebral edema. Now let's move on to the second one, that is cytotoxic cerebral edema. So in this here from the name itself we could able to understand cytotoxic. So something related to cells, or more specifically brain tissue. So here the cytotoxic cerebral edema results from disruption of the integrity of the cell membrane. Here the cell membrane's integrity is getting disrupted. So what will happen? It develops from the destructive lesion or trauma to brain tissue, resulting in cerebral hypoxia or anoxia and syndrome of inappropriate antidiuretic hormone secretion. So one thing you have to keep in mind during cytotoxic cerebral edema, what is happening means something is disrupting the cell membrane. That is, the integrity of cell membrane is getting disrupted, and this will develop in this is happening due to any kind of brain trauma or any kind of destructive lesions, and this will result in insult to or the loss of integrity of the cell membrane, and thereby the blood gas exchange, that is the amount of carbon dioxide and the amount of oxygen in the cells or the brain tissue will be altered, and either it can be due to CR. This is one of the condition I hope you have already studied, and this will be happening in the cerebral hypoxia or anoxia, and thereby results in cerebral edema. So here what will be happening? You have to recollect there is a loss of integrity in the cell membrane, and it is usually develops from any lesion or trauma to brain, and that may result in what hypoxia or hypercarbia, or that is anoxia, absence of availability of the oxygen into the cells, and that may result in increased ICP. Now the third one, third one, that is interstitial cerebral edema. In case of interstitial cerebral edema, what will happen? From the name itself we could able to understand interstitial, something not in blood, nothing related to blood and in cells, something in between, clear, in the space. So interstitial cerebral edema, that is usually results of hydrocephalus. So we have already seen the previous slides and all. Hydrocephalus is one of the cause for edema, that is cerebral edema. So during hydrocephalus, what will happen? Excess accumulation of the fluid in the extravascular or the interstitial space. That's the space between cells and the blood vessel. That is in between the cells. That spaces will be occupied with the fluid, excess accumulated fluid. So that is condition called hydrocephalus, and this will result in cerebral edema. This is what is happening in interstitial cerebral edema. So let's read. Hydrocephalus is buildup of the fluid in the brain and it is manifested by ventricular enlargement. This ventricular enlargement is not confused with the heart and all. This is the ventricles through which the CSF is passes. So if CSF is continuously flowing, this ventricular enlargement will be happening because the excess fluid is getting accumulated in the brain. This can be due to either excess CSF production or obstruction of the flow of the CSF or inability to reabsorb the CSF. Either the production of the CSF is altered or the flow of the CSF is altered or the reabsorption of the CSF is getting altered. Due to this, hydrocephalus may be happen. Hydrocephalus means excess accumulation of the fluid in the brain. This will eventually result in cerebral edema. So these are the three types of cerebral edema. So let's recollect. The first one vasogenic, second one cytotoxic, third one interstitial cerebral edema. Clear. Now we are coming into the most important part, that is pathophysiology of cerebral edema. So here, uh, before going detail into this pathophysiology, you have to keeping in mind this particular pathophysiology reference is from Lewis. So when you come to college, you have to read this book, that is Lewis. So it will be adhered to your mind for always. Clear. So the reference of this pathophysiology is a textbook called Lewis, and you all should read after when you will be in college. Clear. Okay. So, step by step, this cerebral edema is happening in our body. So, due to any etiological factors, that is insult to brain. That is the reason here happening. Any kind of insult, any kind of injury to brain may occur. So, that is the reason, or we can write it as etiological factors. Due to several etiological factors, tissue edema will be happening. So, the first one is tissue edema. That is, suppose the patient have underwent any um, a, road traffic accident, suppose. So patient will be having head injuries. Due to that head injury, the patient's brain tissue is getting swollen. Or another example, if the patient is having meningitis or encephalitis or any other inflammatory conditions, so the patient will be develop a slight changes in the tissue status. That is, the patient may develop tissue edema. Clear. The patient will be having tissue edema. Eventually, this particular edema will what will happen? Increase in intracranial pressure. Due to any kind of brain injury, there will be tissue edema occurrence, and this tissue edema will be resulting increase in an ACP, that is increased intracranial pressure. So when the pressure is getting increases, the ventricles will be go for compression. That is compression of ventricles. Ventricles get compressed because everything within this enclosed skull is getting compressed due to the increasing pressure. Because here we can see the ICP is getting increasing. Because of this increase in pressure, the compression of ventricles happen along with compression of blood vessel. So the ventricles as well as the blood vessels are getting compressed. Here you can see compression of ventricles and compression of blood vessel. What will happen? There will be decrease in cerebral blood flow. The blood flow in the cerebrum, that is the cerebral blood flow, the blood flow in the brain will be decreased because what is the reason? Because everything is getting compressed. The blood vessels is compressing, the ventricles is getting compressing because of this tissue edema and thereby decrease in the cerebral blood flow. Then what will happen? If the blood flow is getting reduced, definitely there will be decreased O2 with the death of brain cell. The oxygen availability will be reduced because the oxygen is provided through the blood supply. So here the blood supply is getting decreased. So what will happen? Oxygen is again decreased. So what will happen? The brain cells will be go for death. Decreased O2 with the death of brain cells. Clear. So due to any injury, edema will happen. That will result in increased ICP. compression of ventricle, compression of blood vessels, decreased blood flow, then decreased oxygen with the death of